Ask anyone, and the first question on anybody's mind is that when will the vaccine be coming out finally? And how soon will it reach the large scale of population, and when and who will be the first receivers of the coronavirus vaccine? The entire mainstay of the Indian economy now seems to be as to how soon the coronavirus vaccine comes to the country and how soon the people are able to get it. In fact, the loss of business and the fall in the economy is now being blamed entirely on the coronavirus pandemic, whereas the slowdown actually had started much before the pandemic hit us. India witnessed more than 50,000 cases yesterday of coronavirus, new cases, taking the national total to over 16 lakhs. Out of 16 lakhs, of course, more than 10 lakhs have recovered so far, thus bringing the national average recovery rate to about 64.54%. Just yesterday, July 31, 2020, 779 new deaths were recorded, bringing the total number of deaths to 35,747. India therefore has the fifth largest national death count after the United States, Brazil, Britain and Mexico. However, Union Health Minister Harshvardhan says that India has reached an important milestone. What you may see as a glass empty, he sees as a half glass full. He says that India has crossed an important milestone, that is 10 lakh recoveries. That is an important milestone according to Harshvardhan, the health minister. And therefore you have that, it's according to him, this is a great moment and something to feel good about. So it's a good number of count of cases which have recovered in India. The active cases in India are about 33.27% or about 1/3 of the total positive cases. Fatality rate is of course progressively reducing and at 2.18% is the least globally at this point of time. A very interesting study says that India may eventually not even need the vaccine if the vaccine is going to take a lot of time, like 2021, or if it turns out to be very expensive to be affordable to the general population. The study says that 15% of India may already have developed antibodies against the novel coronavirus, and that 18 crore Indians or 15% of the country's population have already developed antibodies against coronavirus, taking an error of 3% into consideration. So you already have 15% of the country's population already having developed antibodies. That's also another milestone or landmark, I would say. In the meanwhile, another serological survey conducted in the national capital, Delhi, says that 23.5% of those surveyed have developed immunoglobulin G antibodies support, and this suggests that they already have been exposed to the virus. Extrapolating this to the entire city of Delhi, 1 out of 4 Delhiites may already have developed some kind of immunity to the coronavirus. So the earlier study, which was a pan-India study, was based on 60,000 antibody tests conducted by Thyrocare, and this was across 600 different geological locations in a 20-day period. So we may be heading more towards an herd immunity, that more and more of the population is already getting infected and is also getting immune to the coronavirus. There are only 2 countries that have come closest to following such a policy of herd immunity, and which is the United Kingdom and Sweden. While British Prime Minister Boris Johnson and his government dismisses that it had adopted any policy of herd immunity. In fact, Britain went into a very severe lockdown in March and April as a turnabout from the earlier liberal attitude towards coronavirus. Swedish government has followed what we can call as a partial herd immunity. Sweden represents a much higher or has witnessed a much higher fatality rate due to COVID 19 compared to its Nordic neighbors like Denmark and Norway. Now, the Indian study conducted by ThyroCare is not entirely in every neighborhood. It is more restricted to the urban areas. Besides, it is based on individual requests, also from companies and also housing cooperative societies. ThyroCare study, incidentally, has not been peer reviewed, neither has it been published in any medical journal so far. It is a very rough map of the coronavirus in the urban pockets. But this, taken together with the ICMR study, that is the Indian Council of Medical Research, the figure of 18 crore Indians having been infected with COVID-19, many of whom may be asymptomatic, is probably believable, credible. So I think it is also likely that India may be headed towards herd immunity based on these two studies, one by the ThyroCare, other by the ICMR, the Indian Council of Medical Research. Immunity against further infections from virus, at least for a few months, seems possible, but whether this antibodies that these 18 crore Indian estimated population is believed to have developed is going to something which is going to persist over a period of time, or is it going to come back with a vengeance later on, is to be seen. However, based on past studies of viruses and their effects, one can assume that natural resistance to getting infections the second time is probably in place. So it is possible that you may not get it as soon once again. These studies hold great merit, but again, to repeat, they are of use if the vaccine takes a long time to enter the country, India, and or if it turns out to be rather expensive. India is continuing its battle. What appears to be milestones to Harshvardhan, the Union Health Minister, may not be so great for others. After all, 50,000 plus cases every day over the last few days, and increasing number of cases, although one must admit that the testing has also increased dramatically all over India, definitely raises a lot of alarm. Yet it is quite possible that immunity boosting measures may help more than ever before to India. And no wonder there has been so much demand for Ayurvedic products, the haldi doodh, the ashwagandha, and so many other measures are being used to boost the immunity of Indians. Who knows, the 18 crore Indians who have become who have now developed antibodies may be already on many of these immunity boosting products. In any event, to cut the long story short, yes, if there is more of antibodies and there is more of a herd immunity which develops, then it is also likely that we may, after all, not need the COVID-19 vaccine at all. Take care. Have a nice day. Bye-bye.